everyone. My name is Isabella Caruso, and I am the Regional Epidemiologist for the Greater Boroughs Partnership for Health, which covers Boylston, Northborough, Southborough, and Westborough. Today, we are with Dr. Safdar Medina, and we are going to be discussing the current RSV situation. So thank you so much, Dr. Medina, for being with us today. Could you just introduce yourself for everyone?
Sure. Thank you so much, Isabella, for having me and allowing me the chance to talk about this very important topic. So I am a pediatrician at UMass Memorial Healthcare. I work at their health center in Uxbridge, and I also consult for the Northborough Southborough School District. So work very closely with the local boards of health.
Perfect. Okay, so what is RSV? Why are we seeing it right now?
So RSV, or respiratory syncytial virus, is, of course, one of the many viruses that causes respiratory illness, usually infecting the nose, throat, or lungs. And typically, RSV occurs every year, usually in the late fall through the early spring. However, with mask wearing and physical distancing for COVID-19 for the past 2 years, we had fewer cases of RSV. And once safety measures were relaxed in the spring of 2021, we started to see a rise in RSV and other seasonal respiratory illnesses back in the spring. And of course, now we've seen an early resurgence in the fall.
Okay, and what are the symptoms? Are they similar to COVID and the flu, or?
They are. So like most respiratory viruses, RSV can infect some people and make them very sick, and some people may only get mild symptoms. So most people will get a mild upper respiratory infection. So they may have a fever, which is defined as a temp of 100.4 or more. They may have a cough that's dry or wet sounding. Nasal symptoms such as congestion or a runny nose. They may sneeze. Infants and toddlers may act slightly fussy and may not feed as much as they normally do. However, in certain populations, these symptoms can progress to bronchiolitis or an infection in their lower lungs. And some cases of bronchiolitis can then get very severe and lead to fast breathing, flaring of an infant's nostrils, rhythmic grunting during breathing, and parents may also notice belly breathing where they see tugging in between their ribs or right below their neck, and they may actually hear wheezing. Now, certain groups of populations are at higher risk for RSV, and these are any infant who's 12 weeks old or younger at the start of the RSV season, infants who were born premature or with a low birth weight, especially those born before 29 weeks gestation, any infant with chronic lung disease, babies with certain types of heart defects, infants and toddlers with weak immune systems due to illness or treatments, and certainly if they're around secondhand smoke, or obviously because of the way RSV spreads, those who attend daycare are in other congregate settings.
Great, thank you. That was really helpful. And how common is RSV?
So RSV is very common. Obviously, we see it every single year. It spreads just like a common cold virus does from one person to another. Right now, we're seeing obviously a resurgence. I believe the latest Massachusetts data showed about a 25% positivity rate in all RSV tests that were done. However, I think we have to be very careful because not everyone who has RSV is likely gone for an RSV test, given in a number of cases, it really resembles a common cold and doesn't really need a lot of medical attention. So we probably don't have a very good accurate assessment of how much RSV is actually out there. And typically, historically, in pediatric offices, we don't test for RSV unless there's a need for contagious purposes, or those infants who are hospitalized are always tested for RSV.
Great, that's helpful. And so what is the current treatment for RSV? Or I guess to start, when would you seek out medical attention?
So you do want to seek medical attention if your child's symptoms have gone beyond what you would expect for a mild upper respiratory infection. So as I mentioned, some of the symptoms of bronchiolitis, that indications that the infection is in the lower part of the lung. If there is an infant or toddler or even older child who is dehydrated, cannot tolerate fluids, if there are any pauses or difficulty in breathing, any color changes to the tongue, lips, or skin, or if there's a child or toddler who is definitely not as alert or
Mm.
is acting very, very fatigued. Now, in some children, RSV can lead to a secondary bacterial infection, such as an ear infection or pneumonia, which then does require treatment and possibly antibiotics. And in this case, it would be children whose symptoms worsen or do not improve after 7 days. Anybody with a fever who is younger than 3 months of age, anybody with a fever that's above 104, or poor sleep or fussiness or chest pain or a worsening cough. So these are all signs that medical attention should be sought for a secondary bacterial infection.
Okay, and what is the common treatment for RSV?
So if a child needs treatment, if they don't have a secondary bacterial infection, a lot is supportive care. So, we'll ask families to really run a humidifier in their room, have their child sit in a bathroom with them that's all steamed up. That steam really, really helps. Trying to put saline drops in their nose to help loosen the secretions in the nose. These are very common things people can do at home. We don't recommend over-the-counter cough and cold medications for children. In children over 1 year of age, parents can use honey as a treatment for a cough. They should definitely try to push as much fluids as they can. In babies that are breastfeeding, we try to encourage more breastfeeding, as that also helps transferring maternal antibody to them. And babies over 6 months of age can drink water, so we'll really have parents push water intake for those particular children. A lot of parents ask whether a nebulizer treatment with albuterol or any kind of asthma treatment helps RSV, because babies with RSV do wheeze. However, there's very limited data on the effectiveness of using albuterol or other asthma medication for RSV. The only subset of children that might help are children who have an existing diagnosis of asthma already, older children that may have that diagnosis.
Great. I think those were all really helpful tips for parents out there. And how long typically does an RSV infection last?
So RSV can last anywhere from 7 days to up to 3 to 4 weeks in some children, especially those that are immunocompromised. RSV symptoms are typically worse on days 3 to 5 of illness. And then after day 5, most people start to see an improvement within that 7 to 10 day window.
Great. And you talked a little bit about daycare, but what about like returning back to school or daycare? What would you suggest there?
So that's a good question. Unlike COVID-19, where specific parameters were developed for a number of days, we don't have those for RSV. So historically, what we've always recommended is we want a child to be fever-free for 24 hours, and that's off fever medication, Tylenol or Motrin, and also improving in their symptoms.
Great. That's helpful. And just overall, what are your tips? How can you prevent RSV? I know
So
it's really common, but any tips?
Yeah, so we can do a lot of things to prevent RSV. RSV is spread just like a common cold virus from one person to another. It enters the body through your nose, your eyes. So, we want to avoid direct person-to-person contact of any body fluids like saliva, mucus, or nasal discharge. Washing hands is key. The RSV virus can survive on unwashed hands for 30 minutes or more. So repeated washing of hands is really important. And also, cleaning surfaces regularly. RSV can survive up to 6 hours on surfaces such as toys and keyboards and doorknobs.
Okay.
And the other thing parents can do is, if your child is sick, please keep them home. If there is a sick adult around them, really limit contact with that sick adult. Parents should feel free to, have anyone that's sick refrain from visiting their house, because again, an adult could spread RSV to their child. For younger children, under 6 months of age, especially, but even under a year of age, we'll have moms breastfeed more to give them antibodies. And it's also very important to keep up on other immunizations that can really make infants and toddlers sick. So, everybody over 6 months of age is eligible for an annual flu shot. Everybody over 6 months of age is eligible for the primary series of the COVID-19 vaccine. And Tdap to prevent whooping cough, because children under 6 months of age are very susceptible to whooping cough. So adults around them should really get vaccinated for pertussis as well.
Great. And lastly, is there an RSV vaccine? You just mentioned a few vaccines, but is there an RSV specific vaccine?
So there is not an RSV vaccine, but there is RSV monoclonal antibody,
Mm.
and that is given to select babies through the RSV season. It's given to those very, very high-risk babies, extreme prematurity, chronic lung disease, or chronic heart disease, and they actually get an injection every month through RSV season to give them the antibodies that they need to fight it off. Other than that, there is no vaccine yet for RSV. There are plenty of studies being done. So hopefully someday we will have a vaccine for RSV as well.
Great. Well, this is all super helpful. Do you have any last minute thoughts or recommendations, suggestions for our parents and families out in the region?
No, I think really, we can all control the spread of RSV very well by those simple tips that we talked about.
Yeah, great. And seeking out help when it's dire. Right.
Absolutely. Absolutely. Never feel afraid to call your pediatrician, to call. Everybody has 24/7 coverage, whether it's with a doctor or a nurse, and really avoid going to the emergency room or urgent care centers if you can. Again, a minor cold, we can guide you through. Anything else serious, we can still guide you over the phone and try to help you as much as possible, because ERs are very crowded right now. And the last thing we want is children to pick up other germs in an emergency room.
Right. Right. Well said. Well, thank you so much, Dr. Medina, and hopefully we can record another PSA soon.
Great. Thank you so much, Isabella.
Of course.
Appreciate it.